Uh, Tina, go ahead and do this one. Put our palm together. Tina, can you do that? Wing, can you go ahead and do it? Thank you.
Namo Fundamental Teacher Sakyamuni Buddha. Namo Fundamental Teacher Sakyamuni Buddha. Namo Fundamental Teacher Sakyamuni Buddha. The unsurpassed, deep, profound, subtle, wonderful Dharma in 100,000 million eons is difficult to encounter. Now that I've come to receive and hold it within my sight and hearing, I vow to fathom the thus come once true and actual meaning.
All right, thank you. Before we do it, the lesson, let's do 1 minute meditation first, then we continue on our discussion. Okay, keep your back straight, your neck straight, close your eye, inhale and exhale to the nose. You count 1, inhale and exhale to the nose, you count 2 and keep going. If you see your monkey mind, don't go with it. Let's go come back to your meditation, that means inhale and exhale counting. If you lose track of your counting, start from 1. If don't hold your breath, just do it naturally. Okay. 1, 2, 3. Sit still and close your eye and relax. Okay, all right, thank you. So today we will continue on our study, all right? So we did not want. So basically, we already go to this thing already, right? The risk factor of the depression, it comes from in 3 different categories: biological, psychological, social contact. So that means they are breakdown in three different components. So I don't want to go to, because we spent 2 or 3 weeks on this thing already. So so we will go ahead and go into. I will introduce you the new structure of learning. Okay. I read the book. It's called "Feeling Good: The New Mood Therapy" from Dr. David Byrne. It's a very good book, and this is one of the very good books. I think it become very popular in Western psychology, that they use the cognitive therapy. to counter the cognitive distortion. That's very important. And this will, uh, you will learn this thing along the way. So in this book, we will go through all this thing here. Okay, the first one is they compare the comparison between the anti-depression medication and CBT. That means cognitive behavior therapy or cognitive therapy. Same thing. So you see the result come out very unbelievable. So the anti-depression medication therapy is the old tradition. That is the classic tradition for treat the depressed people. That the same thing with the other. There are three different methods they are using right now. They call it anti-depression medication therapy. The other one is they call it psychotherapy. That means you come and visit the psychologist. Between each section, they will train us how to go overcome the depression. Then they're not necessary to use the medication. But the third one is this is the third technique they're using is called cognitive therapy or cognitive behavior therapy. This is one of the very good technique. It's similar to because basically all our depression comes from the negative thought, right? When we have the negative thought, that's why we have the negative feeling. Therefore, we will have the negative behavior or action that will harm us as well. We harm others, and that basically. This is similar to the way that the Buddha already thought about this more than almost 2,600 years ago. With Buddhist psychology. Later on, I will show you deep into it. So we will go to the book how they deal with the Western psychology dealing with the depression, and later on I will elaborate the Buddhist psychology along the way, so you will see the benefit of a combination of this thing will help. Actually, they combine all the technique together to depend on the certain patient. Sometimes they use one technique or two or three. They combine together, depend on the severe of the patient, right? So it's important. And the CPT that's also used to treat the patient with all the mental disorder, and and also with the patient who have the eating disorder, and self-help. It's the best. It's the best psychotherapy treatment with our medication. What is the self-help? It means that well, the psychotherapy means that we come to the doctor office, right? And they will train us. They will help us to how to deal with the depression. But before we come to them at home, they will have the menu for us. They call it feeling good. Okay, feeling good. The menu about feeling good to help us to boost the mood, right? And when we come to for the next visit, we will they will they use the BDI. BDI that means it's a back depression inventor. That's how they used to measure the degree of the depression. So we will learn all these things. So and they would perform on the experiment of the self-help. Therapy. What does that mean? It means that this similar to the self-help. Basically, it's self-help with the Sidecar Therapy. That means when the doctor wants to, so they use the menu at the homework for the patient before the patient come to the next visit. That basically is, and we will learn all these things together. I just briefly give you introduction about the book, and they also show you the breakthrough treatment. That means they compare all the techniques together to see how this thing works, right? And in the here they will show us with the cognitive therapy and walk us through. Okay, and we have a lot of chapter down there too. I haven't had time to put all together, so we will. Before we move on, Tammy, you understand so far? Do you have any question before we move on?
No questions yet.
That clear? Did I give you the brief introduction to it?
Yes, it's clear.
Good. Good. All right. I will not go to the cognitive distortion. I think that I will at some time when we go to the self-help, that's where we can look at those things and we will see the existing problem of the thought, the mind, and that will be for us to think about it. Right now, if I show you that, that means later on we might forget. Okay. All right. Okay. Let's see. Okay, Hung, go ahead and read the first two paragraphs. Thank you. Oh, what happened? Yeah, I'm sorry. Yeah, all the way to here. Hung, are you there?
Yeah, my internet it's bad.
But it's okay. I can hear very well from you. It's okay.
What do I where do I start
From
and
beginning?
end?
From the beginning to the Sidecar Therapy.
Although we are taught that depression may result from an imbalance in brain chemistry, recent studies indicate that cognitive behavioral therapy may actually change brain chemistry. In these studies, Dr. Louis R. Bachter Jr., Jeffrey M. Sitwartz, Kenneth S. Bergman, and their colleagues at UCLA School of Medicine use postural emissions tomography, PET scanning to evaluate changes in brain metabolism in two groups of patients before and after treatment. One group received cognitive behavioral therapy and no drugs, and the other received an antidepressant medication and no psychotherapy.
Okay, good stuff right there. So basically in here, what they said is the depression is come from the imbalance in the chemistry inside the brain, right? Imbalance. But the imbalance chemistry in the brain is come from many different factors like anxiety. We have sadness, whatever relate to emotion. It would trigger our or something happened, critical event in the past that is trigger that too. It will change the brain chemical, and sometimes and that's why it changed the mood, right? It changed our mood. If the person who have the chemistry imbalance is too critical, that means they are very critical. And usually the medication, the antidepressant medication, it works. It works. The purpose of the antidepressant medication is to balance the brain chemistry. So basically, that's the whole purpose of that. But in the past, they don't know about cognitive behavior therapy, right? What they do, they use the medication too much, and that caused the patient even have more depressed instead of better. So nowadays they know about the cognitive therapy. That means they very caution about the medication, because the cognitive, later on you learn it. The cognitive therapy is also when we change the negative thought into the positive thought. That also boosts the chemistry in the brain. That is balance the chemistry even better than the medication, and that is a wonderful study from the psychologist nowadays. It's really wonderful. So they right now, that's what they do is they divide the two groups, right? One group they call it CBT, that means cognitive behavior therapy, with no drug. That means they hope that group will be the instruction how to deal with the negative thought, and help them to have the positive thought. And so there no need for drug. And that is the experiment they try to do. And the second group is only focused on the medication but no therapy whatsoever. Yeah. All right, Big Wing, đọc the next one.
Where do I start?
As one might expect.
As one might expect, there were changes in brain chemistry in the patients in the drug therapy group who improved. These changes indicated that their brain metabolism had slowed down. In other words, the nerves in a certain region of the brain appeared to become more relaxed. What came as quite a surprise was there were similar changes in the brains of the patients successfully treated with cognitive behavioral therapy. However, these patients received no medications. Further, there were no significant differences in the brain changes in the drug therapy and physical therapy groups or in the effectiveness of the two treatments.
Good. Stop right there. Okay, go ahead and read the whole thing. Read the rest to the brain, to the human brain. Right.
Because of these and other similar studies, investigators are starting for the first time to entertain the possibility that cognitive behavior therapy, the methods described in this book, may actually help people by changing the chemistry and architecture of the human brain.
Yeah, that's wonderful. You see that they experiment on the two different groups, right? The group with the medication, the group with no medication, but the CBT. That's important. And they find out the result is significant. It's the one with the CBT also reduce that means balance the chemistry in the brain, and the result is wonderful, very wonderful. That means they don't need to take any drug, and there no side effect for the medication. That's the most important. Because nowadays a lot of people were afraid of taking drugs, right? Because they're afraid of a side effect. That's normal. So, but this is one of the best way that we learn from this book. It's wonderful with the CBT, or they call it CT. That means cognitive therapy. Okay, that's good. Thank you. Serena, you want to read the next one for me, please? Thank you.
Do I start at CBT can also?
Yeah, that's correct.
CBT can also be used to treat patients with other mental disorders, although no one treatment will ever be a Punica one for all. Research studies indicate that cognitive therapy can be helpful for a variety of disorders in addition to depression. For example, in several studies, patients with panic attacks have responded so well to cognitive therapy without any medications that many experts now consider cognitive therapy alone to be the best treatment for this disorder. Cognitive therapy can also be helpful in many other forms of anxiety, such as chronic worrying, phobias, obsessive compulsive disorder, and post-traumatic stress disorder. Obsessive compulsive disorder, and is also being used with some success in the personality disorders such as borderline personality disorder.
Good, stop right there. Thank you. Do you understand what you just read? Hmm.
Cognitive therapy can help with a lot more like other mental disorders other than like just depression.
That's correct. That's really correct. That's wonderful because yep, they help all the mental disorder. Not all. Remember one thing. Not all the patients have the mental disorder. It's depression or the depression. No. Uh, so so we need to understand the difference between the mental disorder and the depression, right? Depression also considered the mental disorder, but it doesn't mean that all patients with the mental disorder is always depression. No, that is not correct. So what they say in here is the cognitive therapy, right? It's that one of the best form can use for all the mental disorder treatment. This is wonderful without medication. Before this they don't know how to how brain is so important. It's very important. The brain is so powerful, right? The powerful the brain can change anything. When we have a healthy brain, we will have a healthy body, right? So that's important. That means we have to keep our our mind and brain is healthy. That's why in Buddhism, right, Buddha always teaches us to um, to um, to generate the loving kindness and compassion. And that gives us a healthy brain, healthy mind. Therefore, we will have a healthy body. We will have a very little sickness due to the mental problem. Uh, okay, that's good. Thank you. Let's see. Hold on. John, read the next one. John?
Is it the one with cognitive therapy?
CBT can also.
Oh, wait, the first one or second one?
Second one.
Oh, CBT can also be used to treat patients with eating disorder. Cognitive therapy is gaining popularity in the treatment of many other disorders as well. At the 1998 Stanford Psychopharmacology Conference, I was intrigued by the presentation by a colleague from Stanford, Dr. Stuart Agres. Dr. Agres is a renowned expert in eating disorders such as binge eating, anorexia nervosa, and bulimia. He presented the results of numerous recent studies on the treatment of eating disorders with antidepressant medications versus psychotherapy. These studies indicated that cognitive behavior therapy is the most effective treatment for eating disorders, better than any known drug or any form of psychotherapy.
Good. Stop right there. Do you understand what? Tell me what you understand.
Then like they did a study which proved that like psychotherapy was better than like any other drug you could take to like help you with your eating disorder.
Cognitive therapy, right? Cognitive therapy is the best one. That's better than the traditional technique called the anti-depression therapy or Sidecar therapy. So not that the old two technique, but the new one is cognitive therapy. It's one of the best for this kind of disorder. Thank you, John. Jaden, I'm up the next one. Self-help. Jaden, are you there, class? Okay, Kevin. Kevin.
Yes, Ty.
Did you call my name?
Okay. Jaden, you are there? Are you there?
Yes. Do
Okay.
you want me to read?
Yes, we do. Self-help is the best.
Okay. Self-help is the best psychotherapy treatment without medication. Wait, so do I just read the whole paragraph?
Yes, go
Okay.
ahead.
We are also beginning to learn more about how cognitive therapy works. One important discovery is that self-help seems to be a key to recovery, whether or not you receive treatment. In a series of 5 remarkable studies published in the prestigious Journal of Consulting and Clinical Psychology and in the Gerontologist, Dr. Forrest Scoggin and his colleagues at the University of Alabama studied the effects of simply reading a good self-help book like Feeling Good without any other therapy. The use of this new type of treatment is bibliotherapy, the use of books as therapy. They discovered that feeling good bibliotherapy may be as effective as a full course of psychotherapy or treatment with the best antidepressant drugs.
Good, stop right there. Okay, keep going. Because you are almost done. Okay, keep going. Given
Given the tremendous pressures to cut healthcare costs, this is of a considerable interest since a paperback copy of the Feeling Good book costs less than 2 Prozac pills and is presumably free of any troublesome side effects.
Okay, good. Can you tell me what they said in there?
Bibliotherapy might be more effective than antidepressants and psychotherapy.
Okay, self-help is another form of cognitive therapy. So basically, what does that mean? It means that there is the menu, right? Or the book, we call the book, it's called Feeling Good, right? Feeling Good. In that book, if the patient reading the Feeling Good book, what the Feeling Book do is they show you many different type of negative thought, and those type of negative thought, they have the positive thought to counter that negative thought. So once you be able to understand the negative and the positive, you transform the negative into the positive, and that's how you be able to boost your mood, right? That means you boost your chemical chemistry in the brain, and that means you help yourself, and that's what they call the self-help therapy. It's another form of cognitive therapy. Yeah. This is okay. So and this costs only very less, right? Only 2 Prozac pill, very cheap. You don't have to spend a lot of money to go to the therapy and to go to all kind of treatment, and you have to pay a lot of money. No, and then no side effect. But one thing depend on the patient. If the patient have very severe, and of course they need to go to see the therapist to have the professional help them, right? That's important. We still need them, but depend on the condition of the patient. It's important. So on this thing here, we can combine it, and it will become very powerful. So when you learn down here, and you will see the power of this thing. Kevin, you read the next one.
Me, Ty?
Yes. Experiment on. Experiment on the self-help.
Oh, yeah. In a recent study, Dr. Scoggin and his colleague, Dr. Christine Jamieson, randomly assigned 80 individuals seeking treatment for a major depressive episode to one of two groups. The researchers gave the patients in the first group a copy of My Feeling Good and encouraged them to read it within 4 weeks. The group was called the Immediate Biblioth- Bibliotherapy Group. These patients also received a booklet containing blank copies of the self-help forms in the book in case they decided to do some of the suggested exercises in the book. Patients in the second group were told they would be placed on a 4-week waiting list before beginning treatment. The group was called the Delayed Bibliotherapy Group because these patients were not given a copy of Feeling Good until the second 4 weeks of the study. The patients in the delayed bibliotherapy group served as a control group to make sure that any improvement in the immediate bibliotherapy was not just due to the passage of time. At the initial evaluation, the researchers administered 2 depression tests to all the patients. One was the Beck Depression Inventory, a time-honored self-assessment test that patients fill out on their own. And the second was a Hamilton Rating Scale for Depression, which is administered by trained depression researchers. As you can see in figure 1, there was no difference in the depression levels in the two groups at the initial evaluation. Figure 1. The patients in the immediate bibliotherapy group received Feeling Good at the intake evaluation. The patients in the delayed bibliotherapy group received Feeling Good at the 4-week evaluation. BDI Beck Depression Inventory, HRSD Hamilton Rating Scale for Depression.
Yeah, good. Thank you. Okay, let me. Okay, this is what we call the BDI. They have 21 items, right? And this is the score. You can call it the score. Look at the score. So this is this one is used to rating the degree of the depression or not, right? Based on this. So I think it's every day or every week. I'm not sure how they do it. They expect the patient to fill in to circle whatever. Yeah, I guess. So if they add up, if the score is only 0 to 13, it's a minimum depression. That means no need for any. So there is no need for to see the professional or the therapy. If mild, maybe we can use the self help to improve. Or when it comes to the point that it still exists, we need to go and seek for the professional, moderate. Depend. Okay, so this is just the overall. And this is another one we call the Hamilton rating scale. This is another form, also the same, similar meaning. They so they have a similar question, but they ask in a different way. They ask in a different way. So the patient have to fill out every day, I guess. That's what they want to do. And okay, now we look in the figure one right here. So basically, they divide the two groups, right? The first group they call the immediate bibliotherapy group. This is the first group that given the copy of Feeling Good, My Feeling Good for at the beginning. And the second group we call a delay. Because why they call it delay? Because they do not receive the copy of the Feeling Good at the beginning, but on the second 4 week, that means they will receive the because they want to see the difference, right? They want to see the difference. So if we look at the two groups, right, at the beginning, the intake, that means that at the beginning they both the same with the same depression moderate, right? And this is 40 people. Each group they have 40 people. And after the 4 week, after the first 4 week, you see that the one with the feeling good book, right? The book of feeling good, that means they reduce the depression to the normal. That means it's about less than 10. You see that? Less than 10. That means it's very good. It's really good. But the one who did not have who have not received the book yet, so at the 4 week they still the same because there is no treatment yet, right? No treatment. So what does it tell us? It means that the one who read the feeling good book, it improves so well, right? Compared to the one who do not have the good feeling, my feeling good. So they are big different right there. They are very big different. And you know what? After 3 months, both so after the 4 week, the second group also received the same copy. Okay, from this one, from the first group, and after that, both they also. So what they do? What do they do? What do they do with? This is called Sidecar Therapy, and they using the bilateral the therapy. That means the book, right, or the menu, the book, as the treatment, right, as the homework. So basically, every 4 weeks, I think they want the patient to come to the office, so to visit them. To fill out this two form right here, and they based on the score, and that's why they be able to determine where they are. And you know what? Every day, what they do, they call the one that who have the copy of the they call every patient basically. They will see how they doing, everything okay, and they ask them to fill out this form right here. They ask them to fill out this form so they can be able to measure where they are. So that's how they do, and that's important. They also want the one have the book feeling good. They will give the instruction how to use that book and be able to help themselves. That's why they call self-help. Self-help, that means the patient do it by themselves at the homework. That's important. Does it make sense to you? Tammy, right?
Yes, this makes sense.
Okay, that's important. Okay, Victor. Victor có đọc cái này không? The result. Okay, the result.
The results of this study indicate that feeling good appeared to have substantial antidepressant effects at the end of the first 4 week bibliotherapy period. 70% of the patients in the immediate bibliotherapy group no longer met the criteria for a major depressive episode. According to the diagnostic criteria for a major depressive episode that are outlined in the American Psychiatry Association's official diagnostic and statistical manual DSM. In fact, the improvement was so great, most of these patients did not need any further treatment at the medical center, to the best of my knowledge. These are the first published scientific studies showing that a self-help book can actually have significant antidepressant effects in patients suffering from episodes of major depression. In contrast, only 3% of the patients in the delayed bibliotherapy group recovered during the first 4 weeks. In other words, the patients who did not read feeling good failed to improve. However, at the 3-month evaluation, when both groups had read.
You keep going.
Oh.
Feeling good.
Feeling good, 75%. of the patients in the immediate bibliotherapy group and 73% of patients in the delayed bibliotherapy group no longer qualified for a diagnosis of major depressive episode according to the DSM criteria. The percentage of patients who dropped out of the bibliotherapy
Okay, you can stop right there. You can stop right. You can stop. Thank you. So basically, it's, you see that right. The first group, right? The first 4 weeks, it's 70% improved, right? 70% of the patient it no longer met for the major depressive episode. But for the second group, the delay one, it's only 3% of patients that recover. But after the both group, they have the bio therapy menu, the feeling good copy. They after 3 months, you see that the first group is 70%, 75%. The second group is 73%. It's very similar. This year was a very significant study. They found out like it's very significant. So let's see. That's important. The reason why we need to learn all this thing here, we will understand not only the depression, but we understand the treatment as well as the technique they are using. It's so important. Okay. And once we understand this, we can help ourselves, help others. Okay, so okay, Heidi, would you please help me to read the next one, please? The percentage of patients.
The percentage of patients who dropped out of the bibliotherapy group was also very small, around 10%. This is less than most published outcome studies using drugs or psychotherapy, which typically have dropout rates from 15% to over 50%. Finally, the patients developed significantly more positive attitudes and thinking patterns after reading Feeling Good. This was consistent with the premise of the book, namely that you can defeat depression by changing the negative thinking patterns that cause it. The researchers concluded that the bibliotherapy was effective for patients suffering from depression and might also have a significant role in public education and in depression prevention programs. They speculated that Feeling Good bibliotherapy might help prevent serious episodes of depression among individuals with a tendency toward negative thinking. Do I keep reading?
Yeah, go ahead.
Okay. Finally, the researchers addressed another important concern. Would the antidepressant effects of Feeling Good last? Skillful motivational speakers can get a crowd of people excited and optimistic for brief periods of time, but these brief mood-elevating effects often don't last. The same problem holds for the treatment of depression. Following successful treatment with drugs or psychotherapy, many patients feel tremendously improved, only to relapse back into depression after a period of time. These relapses can be devastating because patients feel so demoralized.
Okay, good. Stop right there. Just tell me what they just throw us in here.
So it seems as if the number of patients who drop out of bibliotherapy is pretty small, around 10%, which is less than the rate that you'd see with studies where drugs or psychotherapy is involved. Reading Feeling Good seems to prove that in order to counter depression, you have to change the negative thinking patterns that cause it. And it seems as if
you want to go back?
Oh no, I think I'm good. I think the question mostly remains about whether or not the antidepressant effects of feeling good will last, since it seems that some people do relapse back into depression after being off of I guess the antidepressant effects.
Okay, that's good. That's good. Okay, basically what they said, because remember in the psychology, right? Western psychology, they have three different techniques. The first technique is called the old tradition, very old. They call the anti-depression medication. That means drug. They're using drug to deal with the depression at the beginning. The second one is they call the sidecar therapy. That means we come to the office where the therapists where they will help us section by section. But in the old day, they do not know about the cognitive therapy. So they said that the cognitive therapy, the one that we learned with the feeling good, right? The dropout only 10%, less than 10%, compared to the other old technique. That means the medication and also the psychotherapy. The dropout rate is from 15 to 50%. That means it's a lot. And also they know that the feeling good, I mean the cognitive, it's well improved. It's beyond. The only thing is when we fight with the depression, we need to know how to change the negative, identify the negative thinking and change it, transform that into positive. That's how we defeat the depression. That's what they mean. And also finally the researcher they are addressing they concerned about the feeling good, right? That means the cognitive therapy is that last, right? That last or they relapse. Relapse that means they come back. So what they say is, well, yes, for the two old technique like the work therapy and also the psychotherapy, they will help improve the depressed patient, but for a while it will come back. Okay, it will come back, and when it come back, it will be even worse, right? The patient feels so denormalized, and okay, and that's what they say. The 2O technique, it will not be the good for the long term, and that's what they concern. And what let's see, what about the cognitive therapy? What have study they try to show to us? Houston, the 1997. Houston, are you there, Carl? Houston?
Yeah.
Go ahead and read in 1997.
In 1997.
At the bottom, the last paragraph.
Oh, all right. The investigators reported the results of a 3-year follow-up on the patients in the study I've just described. The authors were Dr. Nancy Smith, Mark Floyd, and Forrest Sagan from the University of Alabama, and Dr. Christine Jemison from what is that?
Tuskegee. Affair Medical Center.
Yeah, my bar is blocking the words on the bottom.
Okay. The researcher contacted the patient 3 years after reading, feeling good. Go ahead, keep going.
And administrated the depression test once again. They also asked the patients several questions about how they had been doing since the completion of the study. The researchers learned that the patients did not relapse but maintained their gains during the 3-year period. In fact, the scores on the 2 depression tests at the 3-year evaluation were actually slightly better than the scores at the completion of the bibliotherapy treatment. More than half of the patients said that their moods continued to improve following the completion of the initial study.
Okay, good. Stop right there. Okay, do you understand what they try to show us?
They improved after the
Hmm.
therapy.
Hmm. Okay. All right. So basically, this is the researcher. They do they follow up with the patient who have with cognitive therapy. That means feeling good, right? Um, After the 3 years, right, they continue on follow up with them to see that how they doing, and most of them say that they doing great, right? They actually the score come out with the score. That means after the 3 years, the score is slightly so even improvement, even better compared to the one that the treatment when they have a treatment at the end of the treatment. So that means they are well improved. So it's wonderful. That means after the 3 years, they not even have any kind of a relapse, right? That means they do not go back to depressed. This is it's a wonderful study. The wonderful finding that they have very well. Aaron, you can read the next one.
Which one?
The diagnostic finding.
Okay. The diagnostic findings at the 3-year evaluation confirmed that 72% of the patients still did not meet the criteria for a major depressive episode, and 70% did not seek or receive any further treatment with medications or psychotherapy during the follow-up period. Although they experience the normal ups and downs, we all feel from time to time approximately half indicated.
Okay, keep going from the beginning.
Experiments on the that when they were upset, they opened up the feeling good and reread the most helpful sections. The researchers speculated that these self-administered booster sessions may have been important in maintaining a positive outlook following recovery. 40% of the patients said that the best part of the book was that it would help them change their negative thinking patterns, such as learning to be less perfectionistic, and to give up all or nothing thinking. It is good that we now have 3 types of effective treatment for depression: antidepressant medications, individual and group psychotherapy, and bibliotherapy.
Good. Stop right there. Okay, tell me what they said. Anna, you want to try? Yeah.
Oh, sorry. Yeah, not really.
Okay. So basically, so the finding is at a 3-year evaluation confirmed, right? The 72% of the patient did not met the depressive episode. That means they no longer in the depression. That's the good news. That's the good news. And further treatment, they don't need any kind of treatment with medication or psychotherapy during follow-up period. That means after that, they don't need those things. And you know what? All of them experience the normal up and down. We all feel from time to time. It's normal. Sometimes you have a mood change, even though the regular person like us, right? We don't have depression. Sometimes we do have the mood up and down. Sometimes it's okay. Not a big deal. What they said is that when they were upset, right, they open the feeling good and read it, and that's how they be able to boost them to bring back the good mood, right? They be able to stay normal without get into depressed. That's a good thing. So the feeling good is always a good reference for them to use over and over again whenever they need it. And they said 40% of the patients said that the best part of the book will help them to change the negative thinking pattern into the positive. That means less perfectionist. Remember, if anyone who want to become perfectionist, they will become depression. Okay, so that's why we need to have a very flexible mentality, right? Do not have a okay, that's important. And they also give up or nothing, because usually sometimes the they call it polarized thought. That means all or nothing. Later on, you will learn about the cognitive distortion. That means the negative thinking. You will learn all those different type of negative thinking. You will know what are they in the future. Okay, all right. Tina, are you there, bro? Tina, are you there? Okay. Tammy, you want to read the next one for me, please? 70% of the therapists.
70% of the therapists polled indicated that they had recommended at least 3 self-help books to their patients during the previous year, and 86% reported that these books provided a positive benefit to their patients. It appears that more and more therapists are beginning to assign bibliotherapy to their patients as psychotherapy homework. Between therapy sessions. In 1994, the results of a nationwide survey about the use of bibliotherapy by mental health professionals were published in the Authoritative Guide to Self-Help Books, published by Guilford Press, New York. Doctors John W. Sandrock and Ann M. Minton from the University of Texas in Dallas, and Barbara D. Campbell, a research associate at the university, conducted the study. These 3 researchers surveyed 500 American mental health professionals from all 50 states and asked whether they prescribed books for patients to read between sessions, were also asked which self-help books from a list of 1,000 they most frequently recommended for their patients. Feeling Good was the #1 rated book for depressed patients, and My Feel Good Handbook, published as a Plum paperback in 1989, was rated #2.
Okay, so what do we learn from here?
So they're talking about how more and more therapists are giving books to patients, recommending books to patients to read as homework to help them become better, and how it's becoming a trend, and how it's really helping patients and people to become more healthier mentally. And that the Feel Good book was the #1 ranked book between all the therapists.
So basically, the Sidecar Therapy, what they do is every time before maybe they meet the patient every week, right, 1 a week, and so the Feeling Good, we call it bibliotherapy book will be homework for the patient. And when they come to the next visit, they will fill out the BDI, that means the back depression inventory, or the HRSD, Human rating, something like that. So they fill out those things each time. So the therapists, they will based on that score, and they can rating where the patient is normal or mild or moderate or severe, right? So and they be able to see, okay, that the patient is good, then and that's how we learn from this. Okay, today we stop right here. So any questions so far? Any question? What do you think? This kind of learning it is helpful to you, Tammy?
Yes, I think it's very helpful. I didn't know, I've read self-help books before in the past, but I didn't know it had its own name now, Bibliotherapy, and had never heard of that before, or this book. So this book's $17.99 on Amazon.
Yeah. I bought that book. I bought the Feeling Good book. That's why I lay out the teaching material for you guys to learn. That book is very beautiful. I read it. I love it. I in love that book. It's in Kaido. That means ebook, right? Serena, and what do you think about this kind of study?
It's something different. I've never heard of like however you say that word. um, it's interesting.
You mean the bio therapy?
Yeah,
Okay, the feeling book.
it's interesting.
Yeah. The reason I lay out this thing here, one, you understand the different method, different technique that Western psychology use, and we also see how they help us to inside the book. They will help us to change the negative thought into the positive, and I will bring in later on. I will bring in the Buddhist psychology, how you not only change your negative thought into positive thought, but you will see the root cause of all the problem where it comes from. That is the Buddhist way. Okay, the Western psychology cannot see that deep level, but the Buddha already show us the deep level, and you will learn that, and that will be the enhance our understanding and will help us to stay away from depression. And you can also help other people to get away from the depression. If you see anyone in have any sign of depression, you will help them to get out of it. Okay. Okay, that's good. Okay. All right. Let me before we close the section, let me do this thing. Okay. Uh, Jaden, go ahead, read anything. Jaden.
May every living being, our minds as one and radiant with light, share the fruits of peace of heart of goodness, luminous and bright. If people hear and see how hands and hearts can find and giving unity, may their minds awake to great compassion, wisdom, and to joy. May kindness find reward. May all who sorrow leave their grief and pain. May this boundless light break the darkness of their endless night. Because our hearts are one, the sword of pain turns into paradise. May all become compassionate and wise. May all become compassionate and wise.
Okay, good. And later on, I will help you to understand the concept in Buddhism we call the bodhicitta. Bodhicitta, it means that um, the loving kindness and compassion is the factor for motivate us to benefit other. It means that it will change our view. Instead of we look in ourselves, right, at the self, at the I, at the me, right, at my, me, and we will look at the whole, at the motive. Okay, that's important. Okay, all right. Yeah, no more you go. Thank you, everyone. I will see you next week. All right. Thank you.
Thank you.
Ngày nào mà phạt chào thầy.
Cảm ơn thầy.
Vâng, thầy, chào
Cảm ơn thầy.
Ngày mai con. Heidi, you understand Heidi? Heidi?
Yeah, I understand.
It's very good, right? This
Yeah.